So once I've identified, for instance, that my right hip is tight, this area around this pelvic girdle, what do I do then if I were your client?
If you were my client, well, I always start with lower back stretches first, just to, that's the core of the body. So we always want to make sure that there's nothing going on up there that can be affecting the hip. Because if
Mhm.
your lower back or your lower lumbar spine is sensitive, that can cause muscles in the hip to feel tight, to guard. So I'd
Like
start with doing so,
compensating.
right, yeah.
Yeah.
So I would start with something as simple as doing a cobra. So trying out a cobra stretch, which is fully extending your spine and then
Mhm.
monitoring how your body feels with that. Of course, if you're doing an exercise, you never want it to be getting more uncomfortable the more you do. And if it is at all a little bit uncomfortable, you want to make sure that it's a low kind of tolerable level, and you only want to continue doing something that is potentially slightly uncomfortable if it makes you feel better afterwards. So if
So,
there's no positive after effect, then it may not be worth doing. You may want to test other things.
so
But
in
I would
terms
start
of
with cobras. Yeah,
yeah, so in terms of spotting good and bad
yeah,
pain, um, I'm assuming good pain is where you feel discomfort and maybe a tightness that you can feel instinctively is releasing, and a
right.
bad pain is more of that grinding sharp.
Exactly. So maybe a tolerable or good pain or something that you can work through is
Mhm,
usually getting easier to do with more
mhm,
repetition, feels like it's releasing. That might not always happen on the first set. So if something is consistent through maybe you doing a set of 10, what you would want to do in that case is check your baselines again. So those things that we talked about, does doing that exercise kind of release your body out of that more guarded state that makes the squat or the bend forward or the knee to chest, whatever your baseline markers was, does it make those any better? And if it does, then although maybe it felt a little bit of a, you felt a little bit of a maybe consistent mild discomfort, it was helping other things. Now we would consider that a good pain, and it should be easier on your second set.
yeah.
And then, like Karen said, it shouldn't be anything that's sharp, and shouldn't be anything that's progressively increasing the more you do. And you want to test two things. You always want to see how you feel during, and you want to see how you feel afterwards in terms of your movements. Are you loosening up at all? Is anything becoming more relaxed? And that's kind of your marker on if your body's in a more or a less guarded state. And of course, you want your body to be in a less guarded state for fertility.